When parents receive a positive allergy test result, I think the first thing they should do is say, good, because now they know what they're dealing with. The time leading up to that can be very uncertain. What's causing my child's symptoms? How do I know what to avoid that's causing their problems? So getting a positive result may sound like, oh, it's a positive result, but it's actually a good thing because now they know what it is that's causing the problem, what to avoid. Avoidance of the allergen is the very first thing that needs to be done. So if it's pets, you've got a choice. You know, either you keep the children away from the pets or you get rid of the pets, or you have to think about, you know, treatment that will avoid symptoms. If it's hay fever, again, there are avoidance measures you can take. If it's a food allergy, for example, peanuts, which can be one of the more severe ones, then you know that you need to avoid your child having any contact with peanuts, even in tiny amounts. And that means looking at food labelling very carefully. It means telling people that they go and visit that they can't have any peanuts. But it's a positive step because if you can identify the trigger and avoid it, you avoid symptoms which can be potentially very serious. If your child has asthma, then it needs to be noted on the management plan for all asthmatics. That means that it's on the medical notes and everyone is aware of it. Everybody at the surgery, the asthma nurse, the doctor, it's on the notes and it's registered. Another thing I think is useful is to ask for a referral to a specialist. Because it's a very good way of finding out more how to manage your child's symptoms, asthma, hay fever, eczema, whatever it is, how to change their medication when it's necessary, adjusting the management, whether it's a reliever inhaler, preventer inhaler, or additional things. So I think a specialist is always valuable once you've got a proven diagnosis. And then finally, talk to your GP about having at hand an adrenaline pen, such as an EpiPen, which is an emergency must-have for people who've ever had a serious acute asthma attack or anaphylaxis. It means you've always got adrenaline to hand for that emergency, and if you know how to use it, potentially it could save a life.